Hi everybody, my name is Mitchell Farmer and this is Laboratory 1, Part 1 of Repro block. This lab is entitled the External Genitalia. So what I wanted to start us off with is the osteology of the hips. The osteology of the hips is going to come up over and over throughout MSK and throughout Repro block, and I will be readjusting these concepts, so if you don't get it right now, that's fine. What I first wanted to talk about or introduce is the idea of the bony pelvis. Now, the bony pelvis consists of the os coxae plus the sacrum. The os coxae, also known as the hip bones, consists of three bones: the pubis, the ischium, and the ilium. The sacrum, the last component of the bony pelvis, is here, and inferior to it is the coccyx, or the tailbone. Now, the os coxae all join at something known as the acetabellum. The acetabellum is right here and contains the head of the femur, seen on the model's right. But there's also two demarcations of the bony pelvis known as the greater pelvis and the lesser pelvis. The greater pelvis, also known as the false pelvis, is the region superior to the pelvic inlet, bound by the wings of the ilium and the anterior superior aspect of S1 of the sacrum. What that basically is you have the pelvic inlet, which is this bony ridge circling around here. And then you have S1, which you can kind of see in the holes, although the sacrum is fused, but this is essentially S1. Everything superior to that, and within the wings of the ilium, if you recall, the wings of the ilium is approximately this area. That is an area known as the false pelvis or greater pelvis, and it contains the sigmoid colon and loops of small intestine, primarily ilium. Now, the lesser pelvis, which is also known as the true pelvis or the true pelvic cavity, is the region between the pelvic inlet and the pelvic outlet. Now, the pelvic outlet's simple enough. That's the area where you can exit here. The pelvic inlet is what I previously described. It's denoted by the pelvic brim, a structure formed by the promontory and ala of the sacrum. This is the promontory of the sacrum, this ridge right here. And the linea terminalis, the right and left linea terminalis, which is basically that bony ridge around the pubis and the ilium, circled here, that I showed you earlier. So everything between that pelvic inlet and outlet is known as the lesser pelvis or the true pelvis. It is bound by the pelvic surfaces of the hip bone, sacrum, and coccyx, and it houses the pelvic viscera and the deep components of the perineum. Now on to some specifics in regard to the os coxae, starting with the ilium. So I'm going to enter that multicolor mode where I've previously shown you some stuff on the ilium, just for a bit of a review here. So you have the iliac crest highlighted here at the top of the ilium, and everything around here is the wing of the ilium. Then you have the anterior superior iliac spine, also known as ASIS, here, as well as the iliac fossa here. There's also the anterior inferior iliac spine, as well as, if I rotate laterally and then we look at a posterior view of the bone, which we are right now, there's also the posterior inferior iliac spine, which forms the dimples of Venus. That'll be an important landmark in physical examination when you do that. Okay, there's also the greater sciatic notch formed at the ilium, and then the lesser sciatic notch is formed at the ischium. But the greater sciatic notch is going to be important when later in the lab I'm talking about the greater sciatic foramen. So that is everything with the ilium. Now on to the pubis. So the pubis, I'm just going to go back into this multicolor mode real quick. The only things I want to show you in here are the superior and inferior rami of the pubis. Here is the superior rami of the pubis, and here is the inferior ramus of the pubis, which actually also joins with the inferior ramus of the ischium to form the ischiopubic ramus. The ischiopubic rami, I'm just going to exit out there. The ischiopubic rami then join at the pubic symphysis, this cartilaginous area joining the two sides of the pubic bones. And they also form the angle of something known as the subpubic angle. The subpubic angle is essentially this. That area right there is the subpubic angle. And just as a note, it is much wider in females than males, mostly because females give birth and need much more space there. And then finally, the last thing I want to talk about is the specifics, some of the specifics of the ischium. So I'm going to go into that multicolor mode and reorientate you. This is the lateral view. This is anterior and posterior. So as previously discussed, you have the ramus of the ischium. But more importantly, if we shift to a posterior view, you have something known as the ischial tuberosity, which is the attachment site of some muscles, but is going to be an important landmark later, as well as the ischial spine. Extending between the ischial spine and the ischial tuberosity is an area known as the lesser sciatic notch. This concavity helps define the lateral wall of the lesser sciatic foramen, which I will be discussing later. So just keep that in mind. Ischial spine, ischial notch, or lesser sciatic notch, sorry, and then the ischial tuberosity. Exit out of that. And finally, the sacrum. The sacrum is relatively simple. I'll just go and do this mode again. It's taken us to a posterior view, so I'm going to orientate us back anteriorly. This is the sacral promontory that I was talking about that helps define the posterior boundary of the pelvic inlet. There's also the anterior sacral foramen, which extend all the way down, through which they transmit the ventral primary rami of the sacral spinal nerves S1 to S4. And then if I rotate posteriorly, there is the dorsal sacral foramen, which transmit the dorsal primary rami of sacral nerves S1 to S4. And then, of course, just below that is the coccyx. One final note on the hip bones is that the ilium and the sacrum form actually a synovial joint. They are not fused, it's a synovial joint, and you can actually get inflammation of that synovial joint, which can present with back pain. All right, so now I'm going to move on to the perineum, or the perineum, as soon as I find where I put it. There it is. Okay. So the perineum is a common region to males and females. It's taken us to a posterior view, so I'm just going to rotate us back anteriorly. And I'm also going to just get rid of this pesky nerve here. And so this is an anterior view, and I'm going to rotate so we are looking up at the perineum, and I'm going to zoom us in here a bit. So this is a view looking basically from the feet upwards, so that we can kind of look into what exactly defines the perineum. So the boundaries of the perineum are the sacrotuberous ligaments posteriorly, highlighted here and here, and the ischiopubic rami anteriorly. So recall that this area here, if I just orientate us anteriorly, recall that this area here was the ischiopubic rami, formed by the rami of the pubis and the rami of the ischium. So that's the anterior boundary, and the posterior boundary is the sacrotuberous ligament. The lateral boundary is the ischial tuberosities, which is what we sit on, seen here, as I showed you earlier where the ischial tuberosities is. I'll just rotate around so you can get a better look. This is what I'm talking about. Rotate back anteriorly, and that view from the feet I was talking about. Now, the perineum can be divided into a series of triangles, or two triangles. Basically, I'm just going to unselect this. Basically, it's divided horizontally by the superficial transverse perineal muscles, highlighted here and here, which define its two triangles posteriorly and anteriorly. So I'm just going to get out my draw tool. So it's divided horizontally, and then its boundaries include the ischiopubic rami anteriorly, one triangle, and then the sacrotuberous ligaments posteriorly. They're right here, but that's kind of the second triangle is right here. So the triangle that is anterior, seen here, that is the urogenital triangle, whereas the triangle that's posterior is the anal triangle. The anal triangle is open, so to speak, inferiorly to the skin, whereas the urogenital triangle is closed inferiorly by the perineal membrane, which I will show you right now and show you what I mean by that. So I'm just going to pull up another view for us right here. And then once again, an anterior view and rotating to that similar view we had before, but now I've added the perineal membrane. I'm just gonna, sorry to rotate around on here like this, but I just want to show you something. So you can see, zooming in here from a posterior view, this is the sacrotuberous ligaments I was talking about that help define the posterior boundary. We can see that the anterior segment of the perineum is enclosed by the perineal membrane, but the posterior segment, approximately here, is not enclosed by the perineal membrane. So now I'm going to rotate us back around anteriorly and look at from the feet again. So, the perineal membrane. The perineal membrane is a thin layer of tough, deep fascia stretching between the ischiopubic rami, essentially along the pubic arch right here, and covers the anterior region of the pelvic outlet. The anterior region of the pelvic diaphragm has not many muscles, and so that's why the perineal membrane kind of exists, because it helps fill that gap in the pelvic diaphragm. Now you can see that several things perforate. I'm just going to redraw in our triangles here. Roughly. Several things perforate the perineum. There is the urethra. In the case of females, there's the vaginal vault, or the vagina. And then there is the anus, which perforates the anal triangle. Now, all of this structure is the same between males and females, with the exception of the vagina in females. And just as a final note, the perineal membrane, as well as the ischiopubic rami, seen here, provide the anchor for the erectile bodies of the external genitalia in males and females, but more prominently in males, which I will show you in the next video. So I'm going to get rid of that painting, and just to show you, this is the anal canal, the vagina, and the urethra, piercing that perineum. Okay, now finally I want to show you the pelvic diaphragm, composed largely of the levator ani muscles. So the levator ani muscles are actually it's two muscles. It's the pubococcygeus and the iliococcygeus, and some anatomists include something known as the puborectalis. They originate, so this is the iliococcygeus and this is the pubococcygeus, and they help form the floor of the diaphragm. They originate from several things. They originate from the tendinous arch, highlighted here, which is a thickened band of fascia from the formed by the fascia of the obturator internus muscle. I'll show you actually the other side of the model. This is the obturator internus, which we'll go over in more detail in MSK. But basically, on its inferior side, there is a thickened arch of fascia that it forms, known as the tendinous arch, and that is where the iliococcygeus inserts laterally of the pelvic diaphragm. Anteriorly, the pelvic diaphragm, or the levator ani muscles, attach onto the posterior or inner aspect of the superior pubic ramus rami of the near the symphysis. So this is the pubic symphysis. As you can see, these guys right here attach onto that inner aspect. Posteriorly, it attaches onto the ischial spine, which I previously showed you already. And then there's also some other insertions onto the coccygeus, the perineal body, and the rectum. Now, the levator ani muscles, along with the coccygeus muscle, form the pelvic diaphragm. So this is the coccygeus, seen here and here, inserting onto the coccyx. So whenever you hear someone talking about the pelvic diaphragm, or the dissector referring to the pelvic diaphragm, think levator ani, which is formed by two muscles, and then think also coccygeus, which is the second component of the pelvic diaphragm. Okay? So that's everything for this first video. It's just kind of a warm up for actually covering the external genitalia in part 2. And you can now check out part 2.